Since we have a couple of you here, we're going to go ahead and get started. If you have any trouble with the audio, please let us know. And if you have any questions, feel free to take yourself off mute or put the question in the chat, or let me know in the chat that you have a question, and we'll make sure your questions are answered. Every 40 seconds, someone has a heart attack in the United States. In fact, heart disease is the leading cause of death for men, women, and most racial and ethnic groups. Of course, we know February is Heart Month, so we're giving you the opportunity to learn more about how to reduce the risk of heart disease and heart attack, which is why we've asked Dr. John Galat, I keep saying his last name wrong, you guys, John Galat, to join us today to learn more about heart health as well as heart attack signs and symptoms to be on the lookout for. Dr. Galat, is there anything that you want to say before we get started?
No, I just wanted to introduce myself as John Galat, and I do heart surgery, and I'm presently in Charlotte working at Novant Health's Presbyterian Medical Center. I've been doing heart surgery for almost 30 years, so I've seen a lot of changes, and very happy and excited to see a lot of new advances that are making a big difference. But this month, American Heart Association has designated as Heart Month in an effort to help raise awareness of the problem here in the United States. It is not an exaggeration, and I don't mean to be dramatic, to say that heart disease is the #1 killer of men and women in the United States. And particularly for women, you hear so much about breast cancer, but the fact is that heart disease kills 10 times more women than all female cancers combined. So a very significant problem, and I'm here just to make myself available for any specific questions or to talk about, I guess, most anything you would like to.
Great. I'll start asking questions, and if anybody has a question or wants to ask a question, make sure you either take yourself off mute or let me know in the chat. So you talked about heart disease. What are the risk factors for heart disease?
Well, there are multiple risk factors that have been shown to be associated with the development of heart disease. But obviously, we have not figured it all out. I know that if I had, I'd have a Nobel Peace Prize in medicine. But this strong associated risk factors, probably at the top of the list is a family history for heart disease. So it is a good idea to be aware of how old parents and grandparents and even their parents lived and what they might have died from. The most preventable risk factor is the abuse of tobacco. And so that's an easy one to tackle because you can choose whether or not to continue. But other factors include things like high cholesterol and high blood sugar and high blood pressure, particularly if any of those problems are poorly controlled.
Right. Can you tell me who is at most risk? I mean, you mentioned high cholesterol, but are men more at risk, women more at risk? Who's more at risk for heart disease?
Well, I can't really differentiate because the risk for women, but prior to menopause, is actually quite low because of the protective effects of estrogen. But after menopause, the risk for women actually approaches and equals that of a man. And many times it can be very difficult to pick out that particular patient who is at more increased risk. You've read many times in the media about a presumed healthy, fit man or woman who dies unexpectedly from a heart attack.
That's a great answer. I've always wondered about women in menopause as far as heart health. Are there any warning signs that someone should be on the lookout for before needing to have open heart surgery?
Well, it can be very, very subtle. In men, it can be quite obvious with the development of chest pains that is often described as crushing or a elephant sitting on the chest. This can radiate or go to either shoulder or to the jaw. I tell patients that my father, who has 3 sons who are surgeons, when he had his first heart attack, went to a dentist because of jaw pain that he just presumed was a tooth abscess, and it turned out to be his heart. So it can be very, very, very subtle. The classic symptoms, though, are chest pain, which can be quite severe. Many times patients associated with this have a sense of impending doom because they are aware that there's something bad happening. And this is often associated with shortness of breath and becoming quite sweaty, pale, the need to sit down. But these are classic symptoms, and many times they're much, much more subtle, particularly in women. It can be something as simple as a very slow progression of exercise intolerance, just not being able to do as much as what they previously were able to do. With some shortness of breath, they may not have any chest pain at all. So just the awareness of a family history that might put them at risk. Other risk factors that we talked about: cigarette smoking, diabetes, high blood pressure, high cholesterol, awareness of that, and then with a new symptom to seek out medical attention.
What are some lifestyle changes that we can make that can ensure that our hearts are remaining healthy?
Well, the main thing is to fix what you know that you can change. So, for example, the most obvious is cigarette smoking. If you smoke, you need to work hard at stopping, not just slowing down, but actually stopping. And when I talk about the use of tobacco, I'm not being critical or judgmental. I'm very aware that it is an addiction and can be very difficult to stop or completely. But it is definitely worthwhile working to that end. If you're aware of your blood sugar being elevated or your blood pressure being high or abnormal cholesterol levels, you need to work with, I recommend a primary care physician that you have confidence in and trust and feel like that you can open up and work with, to work on these things.
Great. We had a question come in from WCNC. Can you speak about the similarities between heart attack symptoms and the symptoms of acid reflux?
So that's a very good question because as I tried to allude to, the symptoms associated with the heart muscle not being able to get enough blood supply to it can be very subtle and can be confused with acid reflux. So my suggestion would be, if you do suffer from acid reflux and you do have risk factors for heart disease, when you're experiencing the discomfort of what you think is acid reflux, is to take something that's going to help immediately, like just a simple Tums, a calcium carbonate, to immediately relieve the acid. And if symptoms persist despite that, I would be more aggressive about having your heart evaluated. But symptoms of esophageal symptoms, and it doesn't have to be just acid reflux, but esophageal spasm, which some patients can get periodic, just sporadically, can mimic the pains of a heart attack.
WCNC, did you have any other questions? I don't think their mic is working. That's okay. Oh, no, all good. Okay, good. Just wanted to make sure. I saw you were off mute, so I just want to make sure. If someone has had open heart surgery in the past, are they still at risk for a heart attack?
So what I explain to my patients is that the advancements in heart surgery have included bypasses that are with arterial grafts, not venous grafts. In the body, there are arteries that are high pressure, carry blood from the heart out to the body. And then the veins are in a low pressure system that return blood from the body back to the heart. And initially, the conduit or detour of blood was with veins. And the advances in the last several decades have been with arterial grafts. And these arterial grafts have been shown to last longer than the bypass grafts with veins. So I do, on every patient requiring bypass, put an artery called the left internal mammary artery that runs along the side of the breastbone onto the most important artery on the heart. And the statistics show that if that graft does well, and in 10 years, 95% of these are wide open, that patient will live out their life as if they did not have coronary artery disease, heart disease. Now, they may get angina or chest pains again, but they will not die from a heart attack.
Great. Does anyone else have any questions before we wrap things up? Okay, great. Well, thank you so much for joining us today. We are so grateful. You're a wealth of information, especially about hearts, which is so important these days. And we will definitely be sending everyone a recording of this. So if you have any other questions after this too that come up later in the day, feel free to email me and we will definitely get those questions answered for you. Thank you so much for joining us, you all. Thank you, Dr. Galat. I'm going to get your name right eventually. And we just appreciate everybody joining us today.
Thank you. Have a great day.
You too. Thank you.